Good morning, everyone. So today we have Nasreen with us. She is a cancer conqueror. So as a part of our cancer healing journey, she is our esteemed guest for this week. And since it is this Sunday, it is World No Tobacco Day. So that is in a way related to head, neck, and mouth cancer. So we thought, why not use the opportunity to spread awareness around cancer, especially head, neck, mouth, and oral cancer. So, and we are very honored to have Ms. Nasreen with us. I'm Dimple Parmar, co-founder and CEO of Lovel's Cancer and Zen Onco.io, working with cancer patients to support in all the way they need help. So, thank you so much, Nasreen ji, for to give your time on this day. And please, I would request you to share your introduction.
Hi Dimple, this is Nasreen Hashmi here, and I am a cancer survivor. And it is a great pleasure that I am a part of this thing which you are doing in whatever way, and hope that I can be of some use to the people who are suffering from this disease.
Thank you so much. So, Nasreen, can you please share about your journey when you were diagnosed? So, when was it diagnosed? What type of cancer? And how your family took the initial shock of diagnosis and planned your entire journey?
Sure. Dimple, I would just go a little back on how it all started because it is very important for people to know that, what could lead to, and how we could cut cut it short, because my thing just got extended because of my ignorance. So I want to share this part also. So please bear with me. Uh, it all started with a tooth infection. I was not able to eat anything spicy and my gums were bleeding. Now, I thought that this is a very, very minor dental issue, which I kept on delaying it for no reason. I said, I'll go, and I just didn't go to the doctor, to the dentist. But one day, some pus showed up on my gums. And that is the time when I realized, okay, now it's the time I cannot delay it any further because I saw something. Till I didn't see anything, I was just delaying it. But when I saw some white pus on my gums, I felt like I should go to the dentist. So I went to the dentist and he had a look at my, gums, and he is like, this looks like a trauma. Maybe a toothpick or something that you have used has caused this injury. So I was like, okay, now what is the way forward? So he is like, we'll do a minor surgery of your gums, we'll clean the pus, and we'll stitch it back. So I was like, okay, but I was supposed to travel in a week's time to US, to my brother's place. So I said, will I be able to recover in a week's time, because I need to travel with two kids and an ailing mother. So, and alone, that also. So he said, no, it is not possible that you will recover completely in a week's time. So I said, can I delay this minor surgery? He's like, yeah, it is absolutely okay. You come back from US and then we will do it. By that time, you have medicines. So I said, okay, great. So the doctor also didn't realize at that point of time. And I took the medicines, I left for US. I came back from US after 2 months. Now, in that 2 months, things got really bad there.
Yeah.
But because the doctor told me that it is a tooth infection, which is a trauma, I kept on having medicines. I was bearing all the pain there. But I didn't utter a word to my brothers that I need to see a doctor. If I would have gone to the doctor there, maybe things would have been different. But anyways, I came back and immediately I went to see the dentist. When he saw it again, the way it had rapidly increased, he is like, oh, this looks different. So I said, what different? He's like, I think we will have to go for a biopsy. You do one thing, you come back. I had gone alone. So he said, you come back with your husband and we'll do your biopsy. Come with someone at least, don't come alone. I said, see, I have delayed it anyways for 2 months now. Now going back and coming with someone, I don't want to delay it any further, not even a single day. If it is biopsy, do it right away.
Okay.
So he's like, are you sure? I said, yeah, I'm very sure. So he did my biopsy. I was alone. Whatever he did, he said, you come back after a week. We will have your results in by that time. I was very, very positive at that point of time that it is just for precautionary measure. He's checking it. There is nothing as such, I was so completely sure that, it cannot biopsy. Of course, the bell rings that biopsy means it has to be cancer. But I said, it's not possible because I don't have tobacco. I don't have gutka. And I occasionally would, with friends do hookah, but that was so occasional, like, not even like once in 3 months. So I don't think that it is possible that something like this would happen to me. And I went home. And after a week's time, I remember the date, it was 13th July, and it was a Friday. And I went to the doctor. I picked my daughter from the school and I went to the doctor. Again, thinking that the reports would be normal. I didn't take anybody else with me. I didn't take my husband or anybody. I was so confident that, I just walked into the clinic and, I was like very happy. My daughter was here and we were like very playful after school. How kids are very excited. So the doctor was in his cabin and he called me in and he saw my daughter. And his instant reaction was, oh, you have such a small daughter. No, without even he telling me the result, I understood that what he meant. And I knew. I said, doctor, is it? He's like, yes. I said, I realized, the moment you told me that you have such a small daughter, I realized that this is the case. He's like, don't worry, I'm here, I'll help you out, and in whatever way you want any guidance and stuff. So I was like, okay, now this has happened, and now we need to take care of it. I was alone with my daughter, and I had to be strong at that point of time. Now, Dimple, you know what? I have been working with insurance for almost 15 years. So, Mediclaim. So, I have come across many patients of different ailments, especially cancer. So, and I know what goes around and how things are, and what patients go through and stuff. So, I was a little mentally, I don't know what happened to me at that point of time, but I was very, very, stable and very calm and composed when I heard this. So from that time, from the clinic to my house, I had figured it out everything in my mind. What I have to do, where I have to go, which doctor I have to approach. And that obviously helped because I had that kind of knowledge of the industry. So by the time I reached home in 15 minutes time, I had figured out everything. I knew that okay, if it is cancer, it is mouth cancer, I'll have to go for the surgery. Then I will have. I know that I have to see the the best doctor in town. That was Dr. Sultan Pradhan, and how and what everything was figured out in my mind before I reached home. Now it came to breaking the news with my family. In my family, I have my mother who stays with me, and I have my husband is there, and I have two small kids. Not too small, but two small kids. So one is 13, one is 13, and one is 6 years old. So now, obviously, we didn't want to break the news to the kids and my mom because my mom is really old, and I really didn't want her to be worried at stuff at this point of time. So I came home. I informed a few friends of mine, and my husband was leaving for some work. So I don't know. He met me at the gate, and I was like, "Where are you going?" He's like, "I'm going out for some work. I'll come back in the evening." I said, "Is it important that you should go today?" He's like, "Yeah, it is important." I said, "Great, you go, and when you come back, I'll tell you something." So he said, "Okay, fine." And he had forgotten totally that I was going to collect my biopsy report and stuff. And he left for his work. I came home. I don't know, halfway he realized that, oh, she had gone for a biopsy report. He left his work, he came back home. And he's like, what is the result? So I shared the news with him that this is the case. He's like, okay. Immediate response was, don't worry, nothing is going to happen. You are not going to worry about anything. I said, I'm not worrying, but you don't worry, because I don't worry. I know you worry a lot. So we both were like on the same page, as far as how we have to deal with this kind of a situation. He is like, we have two kids, we have to pull up a good show. We know it's going to come, you're going to come clean in this. And I really don't want to take stress, and I don't want you to take any stress of this. We will figure out everything. Don't worry. So I shared with him that, see, this is the doctor I want to go to. This is the only doctor I want to go to, and I want to get my treatment from this doctor. And he's like, fine. Immediately we called the doctor, we took an appointment. So they told me to come after 15 days. I said, I can't wait for 15 days. Sorry. Sorry, got disconnected.
No problem. Yes.
Yeah, so where were we?
You were saying that 15 days, your husband got to know about it, and then.
Yeah, so the doctor gave me an appointment for after 15 days. I said, I can't wait for 15 days. I can't even wait for a day. So they suggested that, why don't you come and you wait till the doctor gets free, and then you can just get in. I said, fine, that works for me. So we went at 4 o'clock to the doctor, and at night, 12 o'clock, the doctor saw me. 12:30, I think so. We waited for so long to meet him, but I was like, okay. And so what was very traumatic was, that we were sitting at that clinic for 5 hours, and we were observing each and every patient, because Dr. Sultan Pradhan is a very famous doctor for head and neck. Right. So all the patients who were there were mostly of mouth cancer. And it was very traumatic to see each and every one, especially, I kept on observing everybody's faces, everybody's stitches, how deformed their faces are. And then we have this Google Shri. So I Googled a lot of stuff, and that scared me to a certain extent, by seeing all those deformed faces, like, I might, be one of them very soon. And that was the scariest part of this whole journey, where I would have to deal with this. But I said, it's okay. I think if I am saved with this, I will live with this phase. It's okay. I think what is more important is to survive. So my husband is like, don't worry, it's not going to be that bad and stuff, like usually, people want to tell. And I have to mention my friends. Every time I went to the doctor, my friends were there, my husband was there, everybody accompanied me everywhere, and they have always been there as a big support, speaking to the doctor. And everything was very transparent. It was not that, anything was hidden from me, or, whatever. Everything was very transparent, and that helped me deal with it more better, because that fear of, what are they hiding from me is more scary. So it was very good that we all had a very transparent thing, where whatever the doctor told them, they told me, and, whatever I felt, I told them. And it was very, very open and very understanding kind of a situation. So I think my family dealt with it in a very, very positive way. And we broke the news to my mother after my surgery, because I would be away from the, away from home, and I didn't want her to, at that point of time, feel like, um, and that feel anxiety or something like that, because she is already bedridden, and I didn't want her to go through any kind of stress when I am not around. So once I came back from the hospital, I had told her that I'm going to the hospital for a dental surgery. And once I came back, I broke the news to her. And she was the only one who was a little, uh, obviously she's a mother and was very difficult. She's on bed from last 6 years, and she was the only one who was like, why did this happen to you? I said, this is the only question I'm not asking myself, that why this happened to me. Because when all good things were happening to me in my life, my life, I never asked that question to myself, that why is this happening to me? Then why should I question God today that this is happening to me? It is happening to me, it is a test, and I know that I'm going to come out with flying colors, and all I need is just support, and I know you will give that to me because it's very important. So she also understood, and we took it forward that way. So we are a very good positive family. I have all my life practiced positive energy and positive attitude, and whatever I think, when I think positive, it goes to the universe. The Secret, the book, I've read that book. So I used to practice that a lot in my life. And at this point of time, I said, why not do it right now? When I can apply it in my life, I have to do it. It was not easy. It's not that it just came instantly. When it comes to your health, the first things that come to your mind is all negative. That what if I will not survive? What will happen to my kids? And all that stuff. I have gone through all that kind of thoughts, but I fought back and I said, I will not let these negative thoughts control me. And I I pushed myself. I really pushed myself to think positive, that yes, I will come out of this, and I'm the only one who is going to help myself come out of this. Everybody is going to support me, but I am the only one. If I think positive, I will come out of it, with flying colors. So this thought really helped me, fight it in a very, very positive way.
Wow.
So this was the answer to your question.
I mean, very amazing to know that you had wonderful family support. And usually people take the initial diagnosis as a trauma because we really don't know what's going to happen, how we are going to do certain things, which doctor, which hospital, how we are going to afford it, and many other questions which comes to our mind. Like, should we get opinion? Should we also try other things in parallel? In your case, it's a you're fortunate that you have wonderful family support and you are in the insurance field, so you know a couple of things how it works here. So really happy to know.
Mm.
So your treatment started. How did you cope up with the treatment, and were there any side effects or any challenges which you faced?
Till my surgery, everything was fine. Like, we went to the hospital, we got the surgery done, we were back. Now, in my surgery, my upper teeth, like from year to year, all teeth have been removed, and my hard palate has been removed.
Okay.
Okay. And I just want to share one episode. Since we spoke about the deformation of the face, so my friends knew that I'm most worried about this aspect of the surgery. So I remember that after my surgery, my friend, I was still in my that anesthesia, and my friend comes running to me and she's waking me up and she's like, face is okay, don't worry, face is okay. I said, like, okay. Thank you, that face is okay. And I just slept. I don't know, I just still register that she came and she's like, don't worry, face is okay, he has done very less, he's tried to not do any damage to the face.
Right.
I was like, great. So coming back to your question, the surgery happened, and then the struggle started. Now, for a week's time, he told me to recover from this whole thing and then come back and see him. So the stitches and everything were done. Now, obviously, after the surgery, the first and the most important part was food. How do we go ahead with the food part? So
Right.
while I was in the hospital, I was given pumpkin soup, milk with protein powder, and all that stuff. And I realized now my journey has started. Now is the real time where I have to deal with this aspect. I am a foodie by nature.
Okay.
I love food a lot. Okay, and now I am with pumpkin soup, milk, and all juices, and slowly and steadily in my mind I started preparing myself that okay, now this is going to be the new normal. And we discharged from the hospital. Then the doctor suggested that we go for radiation. And till that time, I started with liquids, juices, soups, and not even semi-solid food,
Right.
because I just couldn't have it.
Right.
And my neck also, they have done surgery on my neck also. So swallowing is also difficult. So I couldn't have morsels or stuff.
Right.
Now, yeah, then this went on and my radiation went on. Things became very, very difficult during the radiation because nausea and, sore, the whole sores and all that stuff was there. And, my skin had turned dark. I had become so weak. I could barely walk to the washroom. Even if I had to go to the radiation, somebody had to hold me and take me. Fortunately, I didn't have to go for chemotherapy. Doctor is not suggesting chemotherapy nowadays to all the patients. So I was saved with that. But uh, I had gone through 60 radiations in a span of 1.5 months. That was every day, except for Sundays. So that was a little difficult part, because even the juices and soups were becoming difficult for me to have.
Yeah.
Yeah, and whatever I was having, I used to just puke, and even a slight smell of some baghar was difficult.
Right.
So all those things were there, and I every day I used to tell myself only one thing, that today is difficult, tomorrow is going to be easy.
Wow.
So every day I used to tell that this is a phase, it is going to pass. This is a phase, it's going to pass. It's just going to be okay. It's just a matter of a month. So I should take each day as it comes. And it became much easier for me to deal with it.
Right.
Then I used to, oh, कल का शायद ज़्यादा बुरा था, आज तो थोड़ा better लग रहा है. So
Yeah.
every day things were different. Sorry. And this is how I dealt with my radiation part. After my radiation was over, the doctor had called me for his consultation after 3 months.
Right.
So for the 3 months, I continued having juices and soups. So totally 5 to 6 months, I was on juices and soups. I lost 40 kgs during that time. And then I went to the doctor for consultation, and then he declared that I am cancer free.
Wow.
So it was a great relief. I think it was just a journey of 4.5 months actually, to see where my cancer journey was over. So at that point of time, when I realized,
Which year?
sorry,
Which year and month?
2000, 2018.
Yeah.
It started in July, and in January he told me that I'm cancer free.
Okay.
And fortunately, it was my birthday month, so we had a nice small celebration at home. So now comes the most important struggle is for oral cancer people is food,
Yeah.
right? So when I went to the doctor, uh, we keep on talking with the patients because there are long waiting hours and everybody is going through the same journey. So we just keep on talking to people. So there was this old man who had a surgery of a similar kind, and I was like, because I was struggling with food a lot. I knew one thing in my head, that I can't continue with this kind of food. I may not die of cancer, but I may die of having such sick food. I just couldn't bear the thought that I will have to have this all my life. So he told me that you can have anything and everything you want. I said, how? He's like, simple है, मिक्सर में डालो दाल चावल रोटी पीसो और खाओ. I was, but that the thought itself was so scary for me. I I was so depressed at that point of time. I just kept on telling my husband, I can't keep going this. I can't have this food. I just can't.
Right.
And he's like, don't worry. We'll figure out something. Don't worry. I That was the biggest worry of my, journey. Food. I just couldn't live with that thought that I have to eat this kind of food all my life. Then we had to get our dentures done. My clip. So
Right.
we went to our dentist, and he gave me a small advice. He told me one thing, that if you eat that kind of food, you will have to eat that kind of food all your life, because then you will accustom your system to have that kind of food.
Right.
You try to eat whatever you want to eat, break it down and eat, but eat. Start with semi solid, then start having solid foods. It
Right.
will be difficult. You may not like the taste, but try.
Mhm.
I took his advice very seriously, because that is what I wanted to do. So I said, okay, it is someone who's telling me that I can.
Right.
Because everywhere where I went, all the doctors, they are like, have liquid food, have semi solid food, churn it and have it. So this doctor told me, you have whatever you want to. Immediately I went from his clinic, niche, ordered for a pani puri with meetha pani, of course, and broke down the puri and had pani puri. I
Okay.
had dahi puri. It was difficult, but I had. Then I realized, okay, it's not difficult. I can have it. Then my journey started with the food. Then I started experimenting with food. I knew one thing: I can't have spices. I can't have red chili. I can't have green chilies. But rest all I can have. I started experimenting with other spices. I experimented with black pepper, garam masala, and all that stuff. So whatever I could adjust and have, I had. So today, after 2 years of my journey, I can have each and every item, each and every food I want to have
Wow.
without any spice.
Mhm.
Now, I mean, my family is very cooperative, and they all have started eating without spice.
Okay.
But I can have non-veg, I can have pizza, I can have burger, I can have pasta, I can have anything I want, whatever I love, I can have it.
Great. Okay.
Only because I tried. Many people don't even try, don't attempt. So it's not difficult. You can try, and you can manage,
Right.
I
Small
feel.
at a time.
Yeah. So I feel it is a very, very big task by which I've accomplished by not listening to other patients, and having that churned food, because I was not ready to accept that situation. So I fought that situation, and I am now able to eat everything I can. Even if I go to a restaurant, I can have food there, obviously without spice. I figured out where I can have non-spicy food and stuff. Like, I can have hummus, I can have a white pasta, I can
Okay.
have a margarita pizza. So even that family outings can you know be done. Otherwise, it would be difficult if we are going out for a vacation.
Yeah.
Where will I hunt for my
Right.
semi-liquid food and churned food? It becomes so difficult. So now, like, I have adjusted to this whole situation, and I think
Great.
this
Great.
is,
Know that.
yeah. So don't give up on anything. I feel you should try, and there will be trial, there will be errors, there will be difficulties, but you will be able to manage, I feel.
Absolutely. So when you broke this news to your children, I'm sure, I mean, they are very small, they are young. So how did they take this news and the changes which was going on with your face and your lifestyle, and then meeting doctors, hospital, surgery, recovery, and all of it. So because they are very young, so how did they cope up with that?
Right, right. See, giving a little background, my 13-year-old child is on his own. He is just too busy with his own stuff. He's a teenager. So I didn't have any issue there. Obviously, we broke the news to him. My younger daughter still doesn't know, because she wouldn't understand. We just told her that mama is not well. Now this girl is on me all the time. She wouldn't leave me even for a second. She was 4 at that time, five at that time, and So I was more worried about, how she will cope up, because I'm going through the struggle and I'm dealing with the stuff. And then if she is on me all the time, how will I get some breathing space?
Right.
But my husband spoke with, I think, her, and told her that mama is not well, so you're not going to bother her. And she started seeing the changes in me, and how, I am on the bed all the time, and I don't have that energy to do anything with her. And I don't know what happened, and she just understood, and she started clinging to my husband instead of me. She needed someone, so she shifted her focus to my husband, because my husband was also available. He had taken a break from his work, so he was managing her quite well. And she phased out from me for that point, like for 4 5 months. She shifted her focus to her father, and
Nice.
now she's back to me. So yeah, I think they were quite understanding and really didn't bother me much. Both the kids, they've been really sweet.
Wow. Okay. Great. Great.
Mm.
What about your office? So you took a sabbatical or to recover from this, or were there any challenges you faced on that front?
No, I have been at home for a very long time now. So I was not working. I used to work before my first child was born. Then after that, I left my job for the kids.
Okay, got
So
it.
there was no issue with that.
Any particular thing which you think that helped me a lot, and if this thing would have not been there, it would have helped you in your journey. So I'm sure, I mean, you have great family support, you had good guidance from the doctor, and you talked about the challenges with the food majorly. So any
Hmm.
other thing you think that I wish I had that support, or I had that thing with me?
See, by God's grace, everything just fell in place. But definitely, I feel that everybody, I am from an insurance background. And the biggest blunder which I have done in my life is not taken insurance for myself.
Mhm.
So I wish that if I had insurance, that 10, 12 lakhs, whatever we spent on my treatment,
Got it.
would have, because we are, you know, not very rich people. We we are manageable and sustainable. Like, we earn and we have a lifestyle and stuff. We are like a little upper middle class kind of people, but we don't have that kind of money handy with us for a treatment.
Right.
But with God's grace, I don't know, somehow the money just happened. But I really wish that if I had insurance, I it would have been really helpful for me,
Definitely.
in this journey, because that is a big hole in the very small pocket.
Right, right, right. Right. And what is the message which you want to give to other patients who are going through the similar journey as yours?
I think you should not take your health lightly.
Mhm.
You Now that you are going through this journey, and ahead of this, everything and anything needs to be taken care of immediately. Don't delay. Have a positive attitude towards this thing, because this is going to pass. This is not going to stay forever. We have to realize that that the situation may be bad, but life is not bad. Life is good, and this will pass.
Mhm.
Simple. This is my this is what I really and strongly feel about anything in life, not only cancer, but now that we are in this situation, yeah, this will pass. It's not going to stay forever.
Right, right, right. Beautiful. Very beautifully you said that. And when you were taking the treatment, of course, treatment had side effects and many other things. So, apart from the medical treatment, is there any other thing, maybe like spending time with yourself, or writing, or reading, or meditation, or yoga, or some pranayama, or breathing exercise, or anything like that helped you during that, or you did that? Any mindfulness activities which you did for yourself?
I didn't do anything. I used to listen to a lot of music and lot of Quran.
Okay.
These are the two things I used to
Yeah.
do a lot. Like, listen to Quran and listen to music. They both healed me in a way.
That's wonderful, wonderful. And I'm sure, I mean, looking at your journey, you never had that fear, what if, or things go wrong, because when you were seeing at other patients who were in the hospital, that okay, something like this has happened. So did you have any second thoughts or any fear about this?
Yeah, see, when I was dealing with the cancer patients that time, obviously it was different. But when I was diagnosed and when I was seeing other patients in the clinic,
Yeah,
that is where the fear seeped in, you know, that, oh, I am one among them now.
yeah,
And yeah, what will happen, you know, with my main thing was, see, for every woman, it is very important about the appearance and the face, and, you know, and so that was my biggest fear. But thankfully, the doctor has done a very neat job. And I had difficulty with my speech in the initial time, which I only felt. My other people said that it is not that bad. It was not that bad, but I feel that there is some speech deferment in the initial time. But now it is okay.
right, right, right. Okay.
Mm.
And your husband has been your great support to you during this entire journey. So what would be your message to the caregivers? Because I'm sure it's not that easy. It's very stressful as well at times. So what message you would like to give to other caregivers?
See, I know. I Are you there? Yeah.
Yeah,
Yeah, sorry. I think what I need to give a message to the caregiver, instead I would give a message to the cancer patients. The message is that you are going through a journey because you have it, okay? But your caregiver, he doesn't have it, but he's going through the same journey with you.
yeah,
So be supportive, don't throw tantrums. I know we are going through a difficult time, but be very, very supportive of those people because they're going to handle you. So don't be fussy about things like, I will not have medicines or I will not have this food. You try on your own, do whatever best you can for yourself. And
right.
because it's very difficult for the caregiver also. In my case, I was not throwing tantrums, but I know many cases where, you know, uh, the patients are very, very difficult, and, you know, they are going through their journey. I understand that, but try to, you know, see this aspect of the situation also. And
Right.
as far as caregivers are concerned, you need to be really patient with the patients, and give them all the love. No sympathy, only love. Try and understand the situation, and just be there for them.
Right. Right.
But yeah, just be there for them, just like a shadow.
Mhm.
Just don't, at times if they don't feel like talking, don't push them. अरे क्या हुआ बताओ, नहीं बताना ही पड़ेगा, ऐसा वाला situation create मत करो. Give them space, give them love, and give them the support.
Yeah.
That's all I feel they should do.
Right. Right. And what has been your most important learning from this journey?
Everything
Got it.
just passes, everything passes, nothing stays forever.
Mm.
Okay, so if it's a bad thing, that will pass, good things will come. I feel that this was a test for me, and I have come out of it,
Mm.
and it's not a big deal. Frankly speaking, don't make it a big deal out of it. It's cancer is very, very common nowadays, and many people are having it, and many people are recovering it, and they are living a very, very normal life after that.
Great.
So don't let this bring you down in any way.
Right. Yeah.
कि अरे ये क्या हो गया मुझे. Don't feel that way.
Right.
This is what I feel like, you know, we should learn from it. You know, it's absolutely okay, we have got it now, we'll deal with it and we'll come out of it.
Mhm.
It's going to be fine.
Thank you. Yeah, very, very important lesson. So good things will come, bad things will pass, and then it's just a time. So,
Exactly, everything is timing, no, everything is time. Yeah.
right, right. Right. And in fact, this week we have run a campaign on Kagaj ki smile. So people are drawing a smile on Kagaj and sharing it. You know that because
Yeah.
on this World Tobacco Day, since your cancer was not related to tobacco, but then it is estimated that 45% of all cancer cases in males and 20% of all cancer cases in females are due to use of tobacco. So, and then Gujarat is known as capital of mouth cancer due to tobacco. So we thought, why not spread this awareness, this sensation towards this issue, and then people. So yeah, it's really important to take care of yourself, and for people who do not have cancer, but then they have a few things which might lead to cancer, like such as consuming tobacco and things like that. But then after talking to your elder sister, I mean, since your was not related to tobacco, but the cancer was similar to those patients. So, but then wonderful message that it's a journey, be strong and fast, great support. So I think family and friends support and the guidance from the doctors matter a lot. So
Definitely. You should just know, I think I was lucky to be at the right time and the right places. I got the right people. So
right,
I was very, very fortunate in that way.
wonderful, wonderful. Very happy to know that. So thank you so much, Queen. Thank you so much for your time and sharing your journey with us. Very inspired, and I'm sure it was not easy as you shared in this session. So because what it feels to live with that every moment is, as a caregiver, I can totally understand. So hats off to you and your husband for being there for each other, and your two small kids, that family, to be there for each other during this difficult time. And it was a matter of 5 6 months, but then today you are right beautifully and strongly. So thank you so much for your
Thank you, Dimple. It has been my pleasure. Thank you so much.
insight.
Bye.